Hi, let's talk about your patient engagement ramp. So, why should we engage patients? Well, patients are the reason that healthcare exists, and yet it's easy to lose focus and make our systems about ourselves. We would never implement a new project without knowing its financial impact or the added work for staff, but it can be easy to implement a project that does not take the patient experience of care into account. Let's remember our model of evidence-based practice. So of course, we should use the best research, the best evidence available to us. And then, of course, our own clinical expertise. It can be easy to forget that the patient's values and preferences really play a strong role here, especially because it doesn't really help us to order the best treatments, the best plans. All of our expertise and all of our evidence doesn't really matter if the patient doesn't follow the plan. And we often won't know if the patient isn't going to follow the plan if we haven't really asked them, if we haven't talked about what the patient wants and what the patient believes. We know that we can improve patient safety when our patients are actually engaged in the plan of care because they're much more likely to follow it. So the big question, how can we engage our patients? This ramp can take many forms. Once again, you'll need to do your research, consider the patient experience of care, and then be creative. Some students have incorporated patient satisfaction surveys or other systems that a hospital or practice is already attempting to incorporate. A common patient engagement tool, a common method is to use the patient engagement tool, which is one of my favorites, something like a shared decision-making tool. So a lot of the time when we think about patient engagement, we think about education, right? As nurses, we always want to educate our patients, and we've been doing this for a long time. So we understand this idea. If the patients were just educated on the evidence-based practice, if they just knew the most recent evidence and knew my clinical expertise, then they would just follow the plan, right? Well, ultimately, patient education is the very lowest form of patient engagement, and education alone just isn't acceptable for a doctorate level project. You need to engage your patients in their healthcare on a deeper level, and then you need to measure both the engagement process and the engagement outcome. So when we talk about decision aids or shared decision-making tools, not all students have a really clear idea of what we mean. There are lots of examples in the course, but I have an example here that shows what I like about patient engagement tools. So a good decision aid should save time. It should make a hard conversation faster and clearer, both for patients and clinicians. So sometimes when you try to implement a patient engagement tool, your staff can give you a little bit of pushback. I don't have time to talk about all that with the patient. I don't have time to do all of these things. The truth is that a good decision aid or patient engagement tool should make a conversation that you already had to have with your patient and that any good provider already needed to do. It should make those things easier and faster, maybe more clearly directed, so that the provider isn't having to come up with all of this information off the top of their head for every conversation. So when we look at this tool, we ask, what is my risk of breaking a bone? So we're personalizing this to the patient. Now, the patient may have already done an osteoporosis scale score, or this may be scored by their age. It sounds like, as I read this, that this patient has likely already had an exam done showing their T-score. So you're able to include the patient's age and their T-score, and then show what else might affect those two pieces of information. So have they already had a fracture, and are they a smoker? Based on those risk factors, we should be able to easily estimate what the patient's risk of a fracture is. Then the point of this form is really to talk to the patient about bisphosphonates. Bisphosphonates it's not an easy decision for a lot of patients. So we need to have some clear way of showing them the evidence for and against, and what kind of things they need to take into account. So this has a little paragraph that talks about what bisphosphonates do and how they reduce bone loss. It shows that 40 and 100 patients will have a fracture within 10 years and that 60 would not, and that's without medication. And then shows the difference with medication, just helping patients to see the difference. It talks about how often this needs to be taken and possible harms. Talks about other concerns like costs. And then it asks a question: what would you like to do? Now, this particular patient engagement tool only asks one question, just asking the patient, what is it that they would like to do? Take the medicine, not take the medicine. If we were to remake this form and make it even better, we would talk about all the other things that patients can do to improve their bone health. We might talk about exercise and calcium intake, all kinds of things that can make a difference in their lives. So let's move on to the next slide. So how do I measure engagement? Because remember I said you're going to measure not only the process, but also the outcome. So you'll have developed a process for how you are engaging patients, and you want to make sure that that process is working. You want to make sure that patients actually receive the form or that they actually participate. So you want to ask yourself, what needs to happen in order for patients to be engaged? And then how can you measure whether or not this is happening? So your process measure is your process happening? Is it occurring regularly? Because you won't know why your outcome didn't work if you don't know whether or not your process was actually being implemented correctly. And then you'll move on to your outcome. Did the process do what I wanted it to do? Do patients have the information, the confidence, the understanding, whatever your desired outcome is, that you wanted them to have? So in this case, the process might be that all patients use the tool, and that's measurable. That tells us whether the plan is successfully making it into practice. And then our outcome might be something on our shared decision-making tool. Our shared decision-making tool might ask patients whether they understand all of their options or whether they feel they have all the info they need to make an informed decision. This question gets to the heart of what we really want from patient engagement. It will allow us to measure our outcomes. You can decide what that question is. What is it that you really want your patient engagement tool to measure, or what is it that you want it to accomplish? And then if you ask a question of your patients, it can help you to determine whether your tool is actually doing what you wanted it to do. So that's a quick rundown on patient engagement. I hope it helps. Hope it helps you to think about this in a different way and to figure out what your patient engagement might be. It may take you some time. You may have to really walk around and think about this and think about it throughout your entire day for a week or so. Think about it as you go about your job. What kinds of things do you think would really help the patients that you see in front of you? If you get stuck, you can always talk to your dedicated faculty. You can talk to each other. Take a look at other DNP projects from the past. See what kinds of patient engagement tools other students have used. Don't worry, you'll come up with something. I look forward to seeing what you do.